This is a WECT Cape Fear Business Break.
Hi, I'm Megan Donahue, and I'm joined by Dr. Alex Thomas from Atlantic Neurosurgical and Spine Specialist. Welcome, Dr. Thomas.
Thanks, Megan.
What can you tell us about spine fractures associated with osteoporosis?
Well, as the name would suggest, these are types of fractures in the spine that we see in patients with osteoporosis. Typically, it's in the low back or in the mid back, and again, it happens in patients who, because of their osteoporosis, have very weak bone. And often, they didn't even know they had osteoporosis until they break their back.
Well, what are some symptoms associated with it?
Typically, the patient has excruciating pain. They're in agony. And this can happen after obvious trauma, like a car accident or a bad fall, but I've had patients who have one of these fractures from just closing a cabinet door or even sneezing, so it can be from trauma that you wouldn't even expect. If the pain starts to go down the legs or you have numbness and tingling in the legs, that can be a bit more serious.
Okay. Now, is there a certain age group that is affected by this, or more women than men?
It's more common in women, as osteoporosis is, and it typically happens in older patients in their 70s, 80s, or even 90s.
Okay. And what can be done about it?
Most often, the pain will get better on its own because the fracture will heal on its own. So we'll prescribe a course of bracing for 3 or 4 weeks. If that doesn't work, there's a procedure called a kyphoplasty that we can try.
And what is a kyphoplasty?
Kyphoplasty is a minimally invasive procedure where we insert needles. We use x-rays to insert needles into the fractured bone. We inflate a balloon. That creates a cavity, and then we fill that cavity with cement. And oftentimes, the relief from the pain is instantaneous.
Bet patients like that.
Absolutely.
For more information, go to AtlanticNeurosurgery.com.
For more details, go to healthfirst on WECT.com.